Hey guys, welcome to another episode of Ask Dr. J, and today we're going to talk about the benefits of digital dentistry combined with an in-house dental laboratory. So when you're at a practice that has these types of technologies, and in our office we have 3D facial scanning, 3D tooth scanning, 3D bone scanning, 3D printing, milling. So these are things that come together with actually CAD/CAM design, and with this whole workflow we can really make patients' lives easier in the dental office, make it faster, and actually helps us to cut costs as well. So let's talk about some of these things. First, when we have the ability to scan your teeth, when you come back in a year, by the way, we can scan them again and see as like a wellness check, have your teeth changed. So if you're someone that thinks you're clenching or grinding but you're not certain, we can do a very quick three-dimensional scan of your teeth when you first come into us, and maybe a year later or 18 months later, and actually measure in microns or portions of millimeters how much tooth structure has been worn away. And that's important because you should only lose 1 millimeter of tooth structure in 100 years. Otherwise, something is wrong. But that's just one little way. But let's talk about the actual workflow from a digital dentistry and laboratory standpoint. So you come in, this is an example, and you've broken a tooth off, and we're going to place an implant, and we need to now find a way to put a tooth in. And let's say it's a front tooth, right? That's the one that you don't want to walk around with nothing. Now, of course, it does vary from patient to patient depending on your bite and other factors, but using the digital dentistry and in-house lab workflow, we can go ahead and scan your mouth, and then using a software called exocad, and there's some other ones, we can actually take that and duplicate the other tooth if we like that, or make changes in this software and tweak it, and you can actually look at it if you'd like, or maybe you do that further for the final. But the point is that when the implant goes in, we scan it, print it out, and then we can just go ahead and screw the tooth in. Again, this scenario is describing a front tooth, not a back chewing tooth. That's a little bit different, and I don't want to go into the biology behind implants in this video. I have other videos that talk about that, but you can see how that'd be a benefit. And here's another thing. So let's say that we have made you a temporary on an implant or another tooth and it breaks. Well, we have that file, and when we get that phone call, hey doc, or if you're talking to the patient care coordinator, you just want to let you know I broke this tooth, I'm leaving on a plane tomorrow to go to Europe on a work trip, what can I do? Well, as soon as we get that phone call, we're scheduling you, we're going in the back, and we're printing it out. So when you're here, there's no having to remake it in the tooth, which is the way I used to do it all by hand. Love doing it, it's artistic, but with the technology, don't love it so much anymore, because now I can plan it, print it, you come in, put it in, and there's no smelly acrylic going on. It smells like you're a nail salon in your mouth, and you get that tooth faster, more predictably. We use that same technology, by the way, when we do our All on X or in our office one-shot smile, and that's when you get a full row of teeth supported by 4 to 8 implants. So for instance, we are going to go ahead and plan your smile before you ever come in. We take our set of records, we plan it, and then day of surgery, we scan the implants. It goes to the CAD/CAM designer. Right now, we are having someone else design for us. They send us the file back in 1 hour. We print your teeth out, stain them up nicely, make them look pretty, and go ahead and screw them into the mouth. And again, the great thing is, let's say you're moving to a zirconia or the really nice high-end finished full arch. Well, we have to wait at least 4 months for your teeth to heal. And if your temporary breaks, or maybe you have to go a little bit longer to spread out the cost, well, guess what? We just go ahead and print it out and put another one in. In fact, I don't even have to be here to do that for you. My clinical partner or assistant can do that. They are certified to do that. So what's the alternative if you have a full arch implant temporary and it breaks and you don't have an in-house lab? Well, first off, when you make that phone call, I don't even know what's happening. I don't know if we have the parts, if I'm going to have to put like a metal beam inside the temporary to kind of patch it up and then have to order a new one from the lab. So it's going to slow the process down. There's uncertainty, which basically creates stress for you as the patient and even for me as the doctor, because I don't want you walking around with broken or no teeth. And again, it's more time for you. It's also can be more money, because as we bring this in-house and do this in-house, we can bring the cost down to help that be a more reasonable procedure. So I get very passionate about this. If you found this helpful, do me a favor, go ahead and like the video or subscribe to our channel. It really helps. And also share this information with someone else. Thank you again for watching another episode of Ask Dr. J.